everyone, and welcome to another episode of Infectious Conversations. This is WVU Medicine's Infectious Diseases podcast, and we now have video recording as well. I'm your host, Dr. Mira Mehta. I'm a clinical infectious diseases pharmacy specialist, and I've been working at Ruby Memorial Hospital for approximately 8 years now. And today we have got a very special guest, Dr. Katessa Howard, with us today. Thanks for being on this show. Katessa, can you tell us a little bit about your role, how long you've been working for WVU Medicine, and also a fun fact about yourself?
Absolutely. And thank you so much for having me today, Mira. It's exciting to be back on the podcast.
It's great to have you.
And back with video. This is
exciting.
It's just exciting. But my role here at WVU Medicine now, I'm our lead antimicrobial stewardship pharmacist for the health system. And I've been at WVU Medicine for a little over 6 years now. So I started here during my residency and my PGY2 infectious diseases residency, and was really fortunate to stay on. We've been working together the whole time.
We go way back.
We do go way back. But I'm excited to see our program grow over the time.
Definitely.
A fun fact about me. So I have one fun fact, and it's that I did do shark cage diving in Shark Alley in South Africa.
Wow, that is incredible. Were you scared at all to swim with the sharks?
You know, like the wetsuits they have you put on are almost like really comforting because they're so tight,
really?
And the water's so cold that you really can't think about anything else.
Wow. Oh, that sounds like an amazing experience. Not sure that I would do it, but sounds like a really cool experience.
Yeah.
So Katessa, today we're here to talk about MedCompass, and do you want to explain a little bit about what MedCompass is?
Yeah, so MedCompass is a website that we have that's built by WVU Medicine that houses clinical practice guidelines. So really, these are what we consider best practice for certain disease states. You know, there's a lot of different resources on there now, and I'm excited to show that in a little bit. But I would like to talk a bit about, where the idea for this came from. So if you've worked in antimicrobial stewardship, we often talk about the quote unquote Stewie struggles.
Right.
And one of those is making sure that the guidance that we develop and the guidance that we put out for our health systems are accessible and followed. So we're making sure our patients receive the best practices or best care that they can. So, something that we've got a lot of feedback on over the years was we had all of this great guidance, but it was stored on our intranet, which sometimes wasn't as easily accessible to the end user for the provider. Some feedback we got was it's not available unless that you're on the intranet. So if our providers were working at home or, not right at a computer, they couldn't get to it very easily. There were a lot of clicks to get to the different sections. And while it had all the great resources we have on MedCompass, we just wanted to make it more accessible. And for a long time, we talked about making our guidance available on an app, really, because everyone has a smartphone, right?
Exactly.
We're always on it, communicating that way. So we said, how do we get our guidelines literally in the hands of the providers, so they can
information at your fingertips.
Yeah, just a few clicks and you're right there. Exactly. So MedCompass really started out as an idea to bring our infectious diseases and antimicrobial stewardship guidance at people's fingertips.
Yeah, it's so great. I use MedCompass at least 5 or 6 times a day, and it really just has our best practices on how to treat these infectious diseases that we see each day. So I love it. I know all of our colleagues use MedCompass, and we're always recommending to our providers and other healthcare professionals to use MedCompass. I think it's been extraordinarily useful for sure. Can you tell me a little bit more about how MedCompass was created?
Yeah, absolutely. This is something that, took a lot of effort and a lot of time and collaboration. So first, I just want to give a shout out to the supporters of MedCompass to make this dream a reality. So I want to give a shout out to our infectious diseases physicians, Dr. Stevens and Dr. Gilfus, our Chief Medical Officer, Dr. Edmond, our IT colleagues, because without them, this would not be possible. So a shout out to ELO's team, Sean Loy and Trevor Nichols, Nickerson, and pharmacy leadership as well. Derek Grimm and Tara Karpinski also supported this. So definitely want to give a shout out to them. And as we look through, how to bring these, like get an app and really have this dedicated resource, there are commercially available applications out there that a lot of other stewardship programs use throughout the country. But whenever we were looking at that and talking with our IT colleagues, they said, we can make that here, and it can be specific to WVU Medicine, which I think is extremely cool, and really shows how talented our IT folks are. So honestly, after we kind of had a few initial meetings and garnered that support and a lot of Teams meetings and Teams messages between me and Trevor, we launched our MedCompass website and web-based application that you can get on your phone in April of 2024. So actually, we're coming up on just a year of having this.
That's amazing. Yeah, it looks like a lot of great minds put their head together to really bring this to life. And so it's really excellent. Contessa, can you show us MedCompass?
Absolutely. Let's get it out.
All right, let's do it.
All right, Mira. So let's go ahead and pull up MedCompass and go through some of its features that we have. So I'm going to actually click on the desktop app. So not only can you download this as an app on your phone, you can save it straight to your desktop. And you see MedCompass will pop up here. I cannot take credit for that name, actually. I think that was our IT group, and it's really a cool name because it does point you in the right direction, I think, like a compass. So when you pull up MedCompass, I have my favorites, which are infectious diseases guidance, and we have a few other things on here now. But if you are a new user to MedCompass, all categories will show up. And actually, if you wanted to favorite anything, so you can have that pop up on your favorites anytime you pull it up, you can just hit a star and it'll go up into your favorites. So it is broken down by adult and children's medicine as well. Like I said, there's other expansion into other service lines on here now too. I think that it goes to show that we had a lot of great feedback just with the infectious diseases and stewardship guidance that other people wanted to expand. But let's focus on the adult infectious diseases guidance. As you see here, when you pull into this, a lot of great folders here to click from. So is there anything in particular that you want to see today, Miriam?
You know what, Contessa, there is. So let's say I have a patient who has MRSA in their blood, or they have a MRSA bacteremia, and it's been going on for a few days now, and it's pretty persistent. Do we have any guidance surrounding that?
You know what? We do have some guidance on that. So if you click on this little search button, and I would just type in Staph aureus, you can see like this pops up because it's a direct hit. But if you wanted to view all and like see anything that has any document specifically on this page of MedCompass that has Staph aureus in it. Let me go back to that. So it's really easy to click on things, as you can see, since I went to the wrong spot, but that's okay. Let's just type it in again. So this is our Staph aureus bacteremia treatment and management guideline. So all of our guidelines that are on here have been approved through various channels. So these are approved through our Enterprise Antimicrobial Stewardship Committee, which is a subcommittee of Enterprise Pharmacy and Therapeutics. So anything on here has been vetted through both of those committees, received multiple rounds of feedback through our infectious diseases providers, various pharmacists, and other clinicians.
So we know this is really the best practices of how to treat these infections.
Yes, it is. And what we put in here in all of our guidance is we take the national guidelines, if national guidelines exist, and we look at that and see how it compares to our practice here.
Right.
So what we're seeing in terms of our susceptibility report, so we take a look at our antibiogram and incorporate that information, so local resistance patterns, and then also our system-wide antimicrobial formulary. Anything that you see on these guidelines will only be the agents that we actually have on formulary. And if something else is on there that's not on formulary, we would actually say like not a formulary agent.
Okay.
But all of our guidance are laid out very similar to this. There's patient population and scope, the purpose of the guideline, key points, and then there's usually a table of contents. Now, you had a specific question with a persistent Staph aureus bacteremia, and this is something we actually see pretty commonly. That could be a future Infectious Conversations podcast.
That'd be great. Thanks for the idea.
But there's a lot of great information on here, and it'll take you right down into the guidance on what we recommend for treatment management, or if we recommend additional consultation with like an infectious diseases provider, if that's available. A lot of great stuff on here. If you wanted to go back up to the top of the document, you could click this, or if you wanted to search directly in the document, say for instance, you're interested in daptomycin. If you put that in, it'll bring up every instance that daptomycin is listed.
It really does make it very simple. And looking back at the folders, I saw there's many different disease states, like many different infectious diseases you can choose from here. If we just want to scroll through and kind of see what's available here, there's really, really a lot of information that can be utilized from this application.
Yeah, so say you had a patient, Staph aureus bacteremia is one of our more severe infections, but say you had a patient presenting with a urinary tract infection, something we see very commonly in the inpatient and the outpatient setting. And guess what? We have guidance for both. Usually we try to group it by disease state, or in the instance of, say you just want to know how to dose something. We also have our adult antimicrobial dosing guidance. We have a lot of other information on here, like our bioavailability. Oral antibiotics are becoming more in vogue now, if you could say. A lot of great new literature out on that, on using highly bioavailable, or just, using and dosing oral antimicrobials appropriately.
Yeah, something cool that I think everyone should see. If you click into the antimicrobial dosing guidance, this is one of my favorite things, but you can actually choose which antibiotic, antifungal, or antiviral that you want to see the dosing recommendations for. And if you just click on it, it will directly take you to that section, which makes things really, really convenient.
It does. And we have a lot of information in here. We take into consideration primary literature, tertiary resources. We dose things based off of the infection type, sometimes even the specific organism, if that literature exists. So a lot of great information on here. I think we have over 40 clinical practice documents that have been vetted. Since we've went live with this, just a few numbers here, we've had over 32,000 document views.
Wow.
And over 7,000 sessions.
Wow.
You do not have to log in to get to this. You can just access it, no login required. Once again, we wanted to make this as accessible as possible. That's just, some raw numbers, but just really goes to show that, people are using this.
Exactly. Yeah.
We actually have a place in here too. I always say, if you want to, you can submit feedback. There's a feedback button. And there's also a new message board. So anytime that we update guidance documents, generally we'll put a message to say, hey, we've updated this, it lives under this file. I will say, if the feedback, I can't tell who submits it. So if you want a response on the feedback, just email me directly. But if you want, just put general feedback, like, hey, I'd really love to have a guidance document on X, Y, and Z. We definitely take that into consideration.
Awesome. So Katessa, you've shown us a lot of great information today. Can you tell me, what is the future of MedCompass?
Yeah. So, we've been at this, we've had this available for about a year now. And really what the future holds is unlimited. We're expanding MedCompass to other service lines. I don't have a direct role in that, because if it's outside of infectious diseases, I usually say that's not my area of expertise. But it is expanding. I'm anxious to see, as our IT colleagues work with this more, what new features that we can offer. Especially, I think the search feature is already great, but it would be cool to get some additional, upgrades with that, if those exist. But we have taken feedback to improve the experience. So we used to actually call this antimicrobial stewardship guidance. And while that's very familiar terminology to all of us that work in that every day, we did get feedback that said, maybe if we call it infectious diseases guidance, it'd be more intuitive for the end user to click on. So we did change that. We added in the antibiogram section. So our facilities that have antibiograms, we added in a folder for that. Now that is only accessible on W Medicine Internet because it's internal data. And the other things we want to do is to continue to do these educational pushes, because this is where we, get more people to use it and give us feedback to make it better. But we have received a ton of great feedback. Every time I've talked about it, people are like, oh yeah, I just pulled that up and you gave a great testimony to it earlier. But yeah, I am anxious to see what we can do in the future. But right now, taking feedback and making it the best we can and having all of these resources there for our providers, clinicians, pharmacists, nursing colleagues, everyone that works in healthcare.
All right, well, thanks for that overview, Contessa. Do you have any final thoughts about MedCompass at all?
I do have one final thought, and I'm going to switch my screen for a second, because if you haven't downloaded MedCompass yet, now is your opportunity to do so. So if you actually hold your phone up to the QR code, that's where you can get a website that pulls up, you click on it, and you can access all of our infectious diseases guidance. And then it'll take you in there to download the app on your phone. So you can have that great resource on your phone that you use every day for everything else.
Yeah, it sounds very easy peasy. And here you can see Stewie. Isn't his name Stewie? He's the little mascot for MedCompass.
Yeah, he's telling you to download that there.
Contessa, one thing I've always heard you say is that everybody's a steward. So you don't necessarily need to be formally infectious diseases trained to be able to perform good antimicrobial stewardship. And I think this MedCompass resource app really allows that to happen. It really allows people to practice stewardship to the most optimal level as possible. So thank you so much, Contessa. We appreciate you being on the show today. Thank you for tuning in, everyone, to our episode of Infectious Conversations today on MedCompass. I was your host, Dr. Mira Mehta, and our guest today was Dr. Contessa Howard. And we hope you tune in to our next episode of Infectious Conversations. Thank you.